Hey, thanks for tuning in. So, just kind of walking you guys through my, the Achilles injury and kind of the recovery process. And it's obviously one of the injuries that nobody wants to encounter or go through, but, it's part of the game for some people. And anywhere from NBA, NFL, volleyball, whatever the case may be, any explosive sport, where you're pushing off with a lot of load on your heel, on that back tendon, this can happen, and it doesn't matter your age, high school, middle school, I don't know, middle school, maybe high school, college, post college, even to your 40s, 50s, 60s, it can happen. Recently, we saw, some like Aaron Rodgers, we've seen Kobe before, we've seen, um, I think the professor as well, even though he didn't publicize it till later. But yeah, so these injuries happen. So I haven't decided to go operative or non-operative in terms of my pathway to recovery. But just wanted to let you guys know that I'd already consulted with the primary care doctor. Not my PCP consulted a orthopedic for me. So had that appointment last week. It went well. He just did a Thompson test, pretty much seeing if my ligament is firing or whatever the case may be, nerves are firing. So then he recommended an MRI, which I got that ordered, and I'll be getting that tomorrow. So we got to wait for that to come, and then the results to come, and then we'll see, whether it's worth doing any surgery or anything like that. So, yeah, because most of the videos that I find, I think they've already decided what route they're gonna take for this recovery. Some people say my recovery, Achilles recovery, after surgery, or some say I've decided to go the non-operative route. So this one, for me, I haven't decided either or. They're both still options for me, and that's mainly because I haven't gotten the MRI. So the MRI is pretty much the indicator of which path to take and which one will be more effective or which one is actually necessary. So with that being said, um, there are some pros and cons. I'm not a medical doctor, consult with your doctors, obviously, but I know for me, it was kind of hard to get information on this, from a person that's actually going through it. So, from my experience so far, let's talk about the non-operative route. Obviously, you don't have to do anything. I mean, you still have to wear a boot, you have to do physical therapy, but like, that's essentially it, just do that. You'll be fine. The thing is that, good thing about it, there's no risk of infection. Some people are concerned about infection, wound healing. So if you have like pre-existing conditions, like, I don't know, like diabetes or anything like that, poor circulation, then this is something you probably want to mention those things to your doctor, okay? And be like explicit about it, not explicit, just be upfront with it, let them know, be thorough with it. Another thing is, yeah, that's pretty much the main the main risk with surgery. Obviously, it can go wrong, but with these minimally invasive procedures, like wound healing shouldn't be a problem, and also or haven't been too much of a problem. And also because before the incision used to be like this big, right? Like now they can do like little holes and what they call minimally invasive. So it pretty much prevents or helps prevent, any wound infections or anything like that. But it still can happen, obviously. So in terms of recovery time, they're telling me both of them are going to be the same. So they're both going to be around 3 to 6 months, mainly 6 months, just to make sure every other ligaments and tendons they're back together, they're working fine, and you're able to like do your everyday activity. Now to go back to sports, back to where you used to be, that's probably going to be 9 to 12 months. We've seen like Kevin Durant, we've seen Kobe, we've seen like Aaron Rodgers take a whole season off, and that's why. And the non-operative one, the main thing is that the con about it is that it has a higher incidence of of re-injury of the Achilles tendon in the same way. And I found out today from my second consultation with the second orthopedic surgeon, he's saying because what happens is the fibers, like the body will find a way to heal itself regardless. You know, it's a miraculous thing that God created that way, and like you get hurt, like it wants to fix itself. But in this case, because it is a tendon, right, and there's like a lot of fibers and things like that, but it can essentially, you know, with time and with the proper boot, which I have on right now, proper physical therapy, like those fibers are, you know, they're finding a way to interlock again so they can become a strong tendon, right? But the thing is, like, say when it's here, half is here, half is here, if they're coming to realign, like it might not be exactly aligned as they probably should, because you are leaving it to chance in terms of the non-operative way of recovery. So what could end up happening is that the fibers are not aligned as they should, and as a result of having that strong, you know, force with when everything is coming together as it should, as it used to be, like it might be like this, or it might be a little bit off. So it won't be as necessarily. There's a chance it won't be as thick as it should be because the fibers are not aligned necessarily as they should, because there's no like anchor to hold it. It's just like, all right, fix yourself. So it can be great though, because in terms of recovery, recent studies have shown that recovery is pretty much the same. Like you're able to go back to your normal activities as before, at a very high chance, you know. So and they're both about 3 to 6 months. The only difference really is that re-injury rate. Now, if you go surgical, there is that chance of infection, but at the same time, like the incidence of re-injuring the Achilles in the same manner is actually less than non-operative, and that's because you do have, with the surgery, they can physically go in there, get the fibers that are kind of lingering, put them together and hold them together with the anchor, okay, and sutures and things like that. And it's just, so now it's, before it can maybe be like this, non-operative maybe. I'm not saying it is, but it's a high chance, right? Because it's just randomized. But with this device, it pretty much holds the ligament together, or the tendon, and it allows it to heal in that manner, okay? And then plus it's anchored to like your heel bone or something like that. So now you have something anchoring it, and then now your body is also, you know, utilizing that natural mechanism of recovery of the tendon, right? Okay, so that's good. And not only that, the recovery time, according to him, he does this quite frequently. He works with high school students, with athletes, I should say, and a lot of people who get these injuries, he says, like firefighters, people who, you know, are now like in their late 20s, early 30s, 40s, and they're starting to putting a lot of load on that tendon, and they do like just sudden movements, explosive movements, you know. So he does it all the time. It'll be like a 45-minute procedure. Obviously before, I think they give you antibiotics. Post, they give you antibiotics just to prevent any infection. And yeah, so the main thing that I got from it was, he's saying it's almost a no-brainer. Well, particularly for my age, right? I have no pre-existing conditions. I'm still going to be looking forward to playing more sports in the future, and I'm just too young really to not want to do that. I mean, I'm not even 30 yet, right? So he says, you know, people your age, healthy, I almost always go with the surgery, just because it's a lower chance of re-injury because you're going to keep playing most likely, and also your tendon will be stronger, right? And the risk of re-injury is a lot less, you know. So And then, oh, the recovery time, he says it actually is shorter. You're able to get back on your feet within 2 weeks. And then it's still gonna take a process, but at least right, you're more confident in that you have an Achilles that's good to go, for years to come. The non-operative way, you have a higher chance of re-injury. So I'm like, at this age, I don't think. Now the other doctor, which was also in his 40s, orthopedic surgeon, was saying if it was him, he would do it non-operatively, just because he is at that age where he's just gonna hang the glove, so to speak, and figure out other activities. And I don't think I'm quite there. He almost convinced me, but I'm not sure if I'm there yet. I still have much, many more championships to win. I just look at the professor, right? Look at the quick movements he does, right? And he had this surgery done, and he's doing fine. Kevin Durant just played in the Olympics. He's played. Just got the most points all time for the USA team after his surgery. But hey, at the end of the day, leave it in God's hands, and he already knows how the outcome is, but I'll just do my part and see, and just pick the best choice, so there you have it. Whether you should go operative or non-operative, up to you. I'll let you guys know as once the MRI comes back. Well, I get it done tomorrow, see what the results say, and then see what the doctors are still saying. I'm praying it's healed. Like, that would be number one. God just just heals me, but there is a path I have to take that's besides supernatural healing. Then that's when we'll keep you guys in tune, guys. But all right, have a good one. Thanks for tuning in. God bless.